Welcome to Hired Up, the podcast for next-level executives and board nominees. We strive for that win-win for all, from navigating the hidden job market to finding confidence to go for what you want at any age, or simply to go out and get yourself hired up. And we especially love helping successful executives make exciting career moves that let them be leading heroes at home, not just at the office. So if any of these challenges are ahead for you, visit us at westgatecareercoaching.com.
A national leader in aortic surgery, Dr. Pozeg completed his medical school in cardiac surgery at the University of Ottawa and University of Alberta, Canada, respectively. He continued with fellowships at the University of Pennsylvania in Philadelphia and at Papworth Hospital in Cambridge, England. Dr. Pozeg's initial training focused on advanced techniques in complex aortic surgery, including TEVAR, endovascular surgery, complex cardiac surgery, heart and lung transplant, and minimally invasive mitral valve surgery. Dr. Zlatko Pozeg joined the New Brunswick, Canada Heart Centre in 2017. He has practiced and worked towards evolving the field of aortic surgery, having a special interest in aortic dissection and aortic root surgery for the last decade. In addition, Dr. Pozeg has an interest in patients with connective tissue disease who have a proclivity towards aortic disease such as Marfan syndrome. Dr. Pozeg has great interest in the endovascular management of all aortic diseases, from the aortic root to the aortic bifurcation, particularly aortic dissection, and believes in the future of total endovascular aortic reconstruction. He is currently the founder and head of the New Brunswick Centre for Aortic Disease, managing and providing complex and comprehensive care for those with aortic illness in New Brunswick and Prince Edward Island, Canada. In addition to Zlatko's medical practice, he's also an ardent bibliophile and has a large rare book collection of illustrated books of anatomy and surgery spanning 5 centuries from the 16th century to modern times. His collection focuses on early Renaissance anatomical and surgical illustrated books, with a special focus on the works of the great 16th century anatomist Andreas Vesalius. He is a member of several international book clubs, including the prestigious Grolier Club in New York and the Association Internationale de Bibliophilie in Paris. And that was an exercise in vocabulary for me today, Zlatko.
There's a lot there, isn't there?
Yes. And just for the benefit of the listener, I've actually been to the Grolier Club in New York City. It was wonderful. So tell us a bit about your book collection before we dive into some of this more juicy stuff.
Yeah, thank you. Thank you very much, Maureen, for having me. It's a pleasure to be here. That's a great question. I always appreciate people asking me about my interest in books and collecting, and it really was born out of an amalgamation of interest in history and medicine, and started, back in my university and high school days, reading about the history of medicine and some of the great characters in the history of medicine who also became some of my historical mentors, whom I have pictures of up in my office where I'm sitting right now, many of them. And a lot of them historically were great book collectors. And I thought, wow, this is such a great, kind of a noble pursuit, an interesting pursuit, extending time, really, where time stands still and you have these great books and pieces of art in your hands that have spanned 500 years and have a great history unto themselves. And it's become a great passion of mine, and takes up almost as much time as aortic surgery, in actual fact. And I've developed a lot of great friends and relationships across the world because of it. So, and it's enriched me in a lot of ways I never thought possible. So, yeah.
So it always fascinates me when I learn about people who knew at an early age what their career was meant to be. And I believe that to be the same for you. So are you suggesting that it was your interest in history that spawned your interest in medicine?
No, I think medicine came first, and then this is something I've pondered to a great degree, and why the strong desire from an early age to go into medicine. And I do remember that feeling very as early as I can remember, and I honestly don't know where that came from. I think it's a combination of influences and really just luck, because my family, there's no one in my family who has a medical background, and um, I just remember having a deep interest for, surgery and what it would be like to be in a sort of this theatrical type environment, and going inside someone's body and fixing a problem. And for some reason, that's been a fascination I had. And I remember our family physician. I always enjoyed going to our family physician, who was there when I was born, and it was in the older days when family physicians did births, and he had an office and a big desk, and someone I always seemed to look up to, and had a coat and a stethoscope and a room full of medical books, and was always seemed very austere and respected, and thought this is something I'd like to achieve. And actually, in actual fact, maybe that's where the book he did give me some of his books after he retired, because he knew I liked books, so I still remember him. So I think it's a combination of early influence that seems subconscious, and there is an element there that I can't explain, but that allowed me to pursue it with great fervor.
And you certainly did. I believe I read somewhere that you were through high school, you studied medical books, and then you studied in university, and I think you moved very quickly into medical school. Is that correct?
I did, yes. So I was in the University of Waterloo at that time in the applied health sciences, and knew I wanted to go into medicine, and was fortunate enough in those times you could get in before achieving a degree. So I got in early and went to the University of Ottawa for medical school, and was fortunate enough to get in early and start my passion immediately, and that's when the book collecting started as well.
And so where do you keep your book collection right now? Do you have a special place for it, like a vault or some type of an controlled environment for them? I know they're
No,
old.
no, no. Well, they're meant to be seen and looked at and enjoyed all the time. So they're just, well, we're in the process of building a new house, so and a new library to go with it. So the current place we're in doesn't have room for all of them, but I have 5 or 8 thousand books that so a lot of them are in storage, but the most are just in our in our living room library that we surround ourselves with. So they're there. We have 2 little kids running around, and they live around they're surrounded by books all the time, and so they're there to be loved and enjoyed and touched and looked at, yeah. So that's how I feel about having them. Yep.
Did you say 8,000 books?
Yes, a lot of books. It's a lot of books. Yes,
Wow.
surrounded. Every room has lots of books, much to my wife's chagrin at
Ah,
times. But
that's fantastic. So
yeah,
I'm sure the listener listening here today is curious about the type of work that you're doing right now and how you are able to help people in our provinces become healthy again. So why don't you tell us a little bit about some of the exciting things you're doing right now?
great question. Thank you. So I was recruited here as a cardiac surgeon in 2017, and I had been practicing heart surgery for about 10 years up to that point. And my wife is from the Maritimes, from Yarmouth, Nova Scotia, and we did have a desire to come eastward at some point. So an opportunity arose that really fulfilled personal and professional desires, or tick boxes were checked in that regard. And they didn't really have a formal aortic surgery program here, and that was my prime interest and what I had trained in. And so it was a great passion of mine. So it really worked out well, and they had new leadership here in the cardiac surgery group, and someone whom I knew and has since become a great mentor. So under his leadership and the group here, we decided to make the move here, and have worked on steadfastly in developing the aortic surgery division here. And that really means providing care to people of New Brunswick and Prince Edward Island with any sort of aortic illness. And a big part of that is an aortic disease clinic, where we follow several hundred people now with various pathologies of the aorta, mainly aneurysms are the main thing, and we provide surveillance for them, so they don't get lost to medical follow-up. So that's very well organized, and we manage them medically. And we have all sorts of options in terms of the most contemporary, sophisticated, up-to-date generational management of difficult aortic pathologies with our group here, whether it be surgical or endovascularly. We're able to manage the entire spectrum of aortic disease here with the team we have developed. So it's been great, because a lot of times these people, if they're not managed under one umbrella, it's very, very easy to fall through the cracks and things get missed, and follow-ups aren't done in a timely fashion. And unfortunately, with aortic pathology, the results of that can be catastrophic. So we think it helps people here a great deal. There's a lot of people who need this service, so we're pleased to be able to provide it.
And for someone listening who may not have a background, and I certainly don't have a background in this area, but I do know the minimally invasive types of treatments help with comorbidities. And so where previously an open procedure might not be possible, now you're able to do an alternative procedure. Can you talk a little bit about that, just to give people a sense of how it works?
Absolutely, and that's a great question. It's hard work keeping up with the technology and its rapid rate of change. I can honestly say many of the operations I do today did not exist in my training, so we weren't trained to do them. They simply didn't exist, and the technology wasn't there to support these operations. And now almost many of the operations I do have been conceived in the very recent years, being helped by technology, and we've been able to do these less invasively, such that many of these are really only done through a needle with access to an artery rather than a big open incision. And this means, being in a hospital 1, 2, 3 days versus 2, 3 weeks, or even more in some cases. And all the while still treating the disease and the aneurysm as well as we would have otherwise. So it's been a radical change in the management of aortic disease. And in actual fact, we're managing patients who would have had aortic aneurysms in the past, and for various reasons, whether they be elderly, frail, have other medical issues, would not have been deemed a candidate for an intervention such as surgery. Now we can offer them a low-risk option, this endovascular stenting or minimally invasive approach, and it's much less risk and much less risk of dying or stroke or heart attack, and they can live longer, where otherwise they would have been condemned to just have their aneurysm and have nature take its course, as it were. So it's radically changed how we manage patients here today, and I think it's for the better.
Yes, imagine the positive impact on families and communities because of this wonderful technology and expertise that you have.
It's been immense, absolutely. And like I said, we're managing the patients we're dealing with and managing, and the complex issues they have, who otherwise would not have been managed and would have been sent home in a palliative manner, and now are fixed and can go on with their lives and have a strong quality of life as well.
So would they, for example, be able to go back to sports and things like that, Zlatko?
Yes, in some cases, absolutely. They resume normal life activities, absolutely. Many young patients who come in with aortic issues or aneurysms, and aneurysms are the main sort of pathology we deal with. So the traditional patient would have an aneurysm diagnosed by whatever means, usually incidentally. It's found on a CAT scan being done for another reason. And then they would contact the New Brunswick Center for Aortic Disease or the New Brunswick Heart Center, and they would get referred to me, and I would assess them. They would proceed through the pathway of management and assessment, and sometimes that means watching them, or they reached indication for intervention, whether it be surgery or endovascular management. We would go down that pathway, and if they were surgical or had an intervention, we would schedule that, and then that once they were recovered, they would go back to their regular lives.
That's fantastic. This is so fascinating. So in terms of new technology, I'm always curious as to how new technology is introduced to people like you. So I'm assuming that it would come from where? I wouldn't know.
Right. Well, the aortic community is quite a small community, and it's certainly sort of a meritocracy. So I think the more you do, the more you kind of put yourself out there and try new things. I think things do end up coming to you. So, we do a lot of first year, and there's a lot of advancement. One particular area is the type of stents we use and the location in the aorta. So there are companies always out there developing new stent technology, and on a not infrequent basis, we are often asked to be involved in early trials of looking at these new stents and seeing how they work, just because we have a lot of based on my background, we have a lot of experience dealing with this. As I said, we're one of the bigger endovascular centers, certainly in the Maritimes and in the country. And so we have a lot of experience. And this comes with the backing of sort of cultivating relationships in our specialty and across specialties. So it really must be emphasized that this is really, this would not be possible with me on my own. This is a very strongly collaborative effort. And that when I say collaborative, I really mean that in its truest sense, in that not only my surgical colleagues are involved, but we have radiologists who are highly specialized in interventional radiology, specifically aortic interventional radiology, whom I work with on a daily basis, who are tremendously skilled and without whom I wouldn't be able to do this. And we have 3 here in New Brunswick and St. John who I work with closely. So they would be one avenue by which new technology would be introduced. I also work very closely with my vascular surgery colleagues who are interested in this in similar work, and then industry. So we have I have contacts in industry, and like I said, it's a fairly small group, and there's sort of a few. There's a cardiac, there's an aortic. Canadian Aortic organization that we all sort of discuss and meet regularly and share cases and thoughts and ideas moving forward. So there's multiple avenues by which this new technology reaches us. But again, it's sort of an experience-based meritocratic system whereby the more experience you have, I think the more opportunities that one has in leading the being on the forefront of new procedures.
Yes, and of course, there's necessity is a mother of invention, and I know because of the issues relating to COVID-19. Of course, we're recording this in the midst of the second wave in early 2021. How has that impacted your ability to collaborate with industry and with other professionals across the value chain in this space?
Well, it's been an interesting, and a lot of changes have come out of this. I think ultimately we will find for the better in terms of patient care. I think by virtue of technology, we have greater access to experts and We're doing a case here in the next month or so, which is one of the newest stents on the market for treating a certain type of aortic disease, and it's with a particular company who has developed an exceedingly high-level method of live streaming. So, they come in a day or two before into the operating room, cameras, TVs, microphones are all set up, and we do the case. We have the company support and the experts in the field who have done this particular graft, and they're able to be live streamed and almost as though they're there. And otherwise, before COVID, we would have had just perhaps one representative from the company in the room and not have the benefit of 10, 20, or 50 people being live streamed in to help us with the case. So that's helped, I think, and that continues to evolve. So that has helped us a great deal. Does that answer your question? I'm sorry if I got sidetracked.
No, not at all. That absolutely answers my question, because there is the virtual world is not going away, and finding ways to collaborate over the internet is a growing technology, and it's being refined all the time. So are you saying that this particular technology is not a regular streaming service? This is something that's new and unique to your particular procedure or your particular hospital?
For this particular case, we've never done this before. So, like I said, we usually have a representative from a company for doing a new device or a new piece of equipment would be here, who would come from, if they're local, but often they're not local. They would fly in and be with us and proctor us, for example, through the case. But, with COVID, we're not able to do that. And so people are at home or in their offices, in their hospitals, and live stream. And so our case will be live streamed, for example, to, company managers, proctors, other surgeons, all who'll be able to, provide us with tips and tricks of doing a novel and new case that we haven't done before, and using this newer type of stent. So that's an example. So I've not done that before in that fashion. So I think it's and neither has our team here. So and I think it'll be invaluable.
Yeah, absolutely. Lots of growth and capacity building there for sure, I'm sure.
Absolutely.
Yeah.
And the other flip side is with the patient contact. I mean, I think this will facilitate patients being more engaged digitally. I think with telehealth has become a big issue in medicine during COVID times, and I think New Brunswick, as you know, in the Maritimes, we have great geographic disparity. So if I have a clinic of 10 people, 6 or 7 of those may be coming from 3 or 4 or 500 miles away, just to see me. They take a day off work beforehand, they have the appointment, then drive back the next, so it's a big event to come here to St. John for an aortic surgery appointment. So I think this will facilitate us reaching more people and providing care.
It's absolutely fascinating, and it's such a unheard of technology, being able to improve the lives of people in a way that was not possible not even all that long ago. So I'd love to talk a little bit more about sort of your career. I love to say that, people work on their career, or should work on their career as much as they work in their career. And I'd love to know a little bit about overall, I guess at a macro level, maybe what has surprised you the most, I guess, in your career so far, Zlatko?
What has surprised me the most? Well, interesting. Yes.
Did I surprise you with that?
No. It's a good question. We're so in surgical training, we're so focused in what we do in the operating room that, in actual fact, once we're well onto our careers, that ends up being the smallest portion of our career development. That's not really, maybe because we're so good at it by that point, but really it's all the other things that occur outside the operating room that are important. I alluded to developing and cultivating relationships, communication, having a plan, goal set, and that sort of thing. So, that all that sort of thing, all those things that we weren't really taught as we went through training, but really that ends up being what propels one forward in their career and achieve results and advance and make a difference. So that surprised me the most, the degree to which all those other things needed to be fostered and developed and worked on. And I think that caught me off guard. And I think I'm well on my way with the mentorship. And I think mentorship is a very important thing in any field, certainly surgical, which haven't done well historically in surgery, to have great mentors and cultivate those sorts of relationships. So, especially here in being in the form of a leader in the aortic surgery group here, and learning all those things of how to cultivate relationships and develop collaborations and be an effective leader in a team is absolutely critical. And that's learning how to do that and needing to learn, and how important it is to learn how to do that is probably what surprised me the most.
So are you suggesting in medical school or in your other training, you weren't directed to leadership training? It wasn't part of the syllabus, would you say?
In general, that there's not much focus on that. No, I think we're so focused on the medical aspect, on the anatomy, physiology, all that sorts of detail and it's part of it's just pragmatic. It's just hard to get all that information in. And I think, now I think medical school is different today, and it's sort of learning how to be a learner rather than just pounding information into students all the time. So I think things have changed, and, education has had to move along with the times as well. So I think it has changed in the interim, but in my time, no, that was not the case. So we've kind of had to learn that on the fly as we go here. And some do it better than others. Yeah.
Sure. So one of the things I'm often asked, because I do have medical students from time to time who call in and want to have a conversation with me, they want to know, what is the best strategy for, and we're kind of going backwards here in terms of medical school, but what's the best strategy for making a good application to medical school today? What would you say that would be?
Oh, good question. I think a broad background is good. I think, early on it was just sort of being focused on science and medicine, but I think to me I think I contribute a lot of my success to having a greater interest in the humanities and a broader interest base, whatever that may be. Mine happen to be history and book collecting. And the arts and that sort of thing. So I think that's important. Demonstrating the ability to be a learner and adapting with a rapidly changing information technology and so on is critical. I think the basic things will always be there in terms of having good grades and that sort of thing is a given, obviously. And keep trying. I think the other thing is sometimes it's just good people just don't get in just because of numbers and quotas. So I think you just have to keep trying and realizing that you may not gain success on your first attempt. So I think a broad interest, other interests other than medicine, I think will keep you in good stead, and I think medicine has become much more humanistic, and I think those qualities are more and more important. I think most people can learn the basic medical things or know how to learn them when they need the information, but it's the other things in medicine, the humanism, I think that's more important, and to see those qualities in individuals, I think those are the most successful physicians in my view.
Yes, and we talked a little tiny bit about this earlier about mentorship as well, and I believe, based on my own experience and just observing others, that having a mentor is just as important as being a mentor. And I think that I think it's helpful to to offer that type of leadership toward others, especially on our teams and within that broader community. So being a mentor and having a mentor, I think, are really good assets for the future.
Absolutely. And it's something that, you know, the old school mentality in surgery hasn't allowed for that, but that's changing drastically. So, you know, we really emphasize it and focus on it. And I make sure I always have someone who I look up to as a mentor historically and in my current life, who, you know, in various fields, not just necessarily medicine, but in life, and have no problem in reaching out to them when I feel the need.
Mm-hmm. Yes, I like some of the historical figures too, especially Albert Einstein. I get a very great deal of delight reading his stories and his self-deprecating humor, and you know, others as well. I think it's helpful to look back into history and look at some of those lessons.
Absolutely, and these people have created sort of core principles and behaviors that they've espoused and lived by, that is applicable to all of us still, and transcends time, and so I think it's still applicable to all of us in all aspects of our lives.
Mm-hmm. Well, Zlatko, this has been amazing. I've really enjoyed our conversation. Is there anything else that you would like to share with our audience today before we sign off?
No, I appreciate the opportunity. Thank you very much, and it's been a pleasure talking to you, and I'm happy to talk with you again in the future. It was very enjoyable. Thank you.
You're welcome. It's my pleasure. Maybe we'll have an opportunity to talk a little bit about the technology piece. I think people will find that very, very fascinating as it assists you in caring for your patients.
Absolutely. I mean, our specialty is very, very technology driven. It's highly technology driven. So I'd be happy to delve into that or take a deep dive into that with you in the future.
That's wonderful, Zlatko. Take care. Thank you so much.
Thank you. Bye-bye.
Okay, bye.
Thanks for listening to Hired Up with Maureen Farmer. If you enjoyed the show today, please tell a friend and write a review for us. For customized resources to help you get hired up to your next C-level position, visit westgatecareercoaching.com. Do you struggle to find words for emails, phone calls, and job applications for your C-level job search? Get our CEO Script Vault, job search scripts for busy executives to help you get hired up. Kindle edition available on Amazon.com. We'd love to welcome you into the Westgate family of success stories.